Hello friends, today I am going to discuss with you topic clinical audit. Now what is clinical audit? Clinical audit is a quality improvement process that seeks to improve patient care and outcomes through systematic review of care against explicit criteria. Where indicated, changes are implemented and further monitoring is used to confirm improvement in healthcare delivery. So, in easy words, clinical audit is a way to find out if healthcare is being provided in line with standards and lets care providers and patients know where their service is doing well and where there could be improvements. The aim is to allow quality improvement to take place where it will be most useful and will improve outcomes for patients. Clinical audits can look at care nationwide. National clinical audits and local clinical audits can also be performed locally in trusts, hospitals, or GP practices anywhere healthcare is provided. In more simple words, clinical audit is a process whereby actual practice is compared against explicit standards of good practice. And these standards of good practice are formulated after thorough research. Now, these are the main stages of clinical audit, and I will discuss it with example. I am taking the example of postpartum hemorrhage. Now, first step is selecting a topic. For example, you are working in a tertiary care hospital and you notice that there is significant increase in postpartum hemorrhage cases for the past 2 to 3 months. You want to know the cause and try to fix it. So you will discuss this with your colleagues and with your senior. Now, after that, second step is agreeing standards of best practice. Audit criteria. Now, when you know the cause, you want to know what is the reason of postpartum hemorrhage, you will look for the standard practice points doing in the work to prevent and minimize the risk of postpartum hemorrhage. Then collecting data. Then you will collect data by going through the files of the patient who goes into postpartum hemorrhage. You interviewed your colleagues and staff nurses and try to find the reason. Analyzing data against standards. In this, you will find what is the problem, and you came to know that in standard practice, oxytocin should be given after the delivery of the baby, but in your setup, due to busy schedule, nurses sometimes delayed to give oxytocin to the patient. This is the main cause of patient going into postpartum hemorrhage. After analyzing data against standards, you will do feeding back results. Once you know the main reason, you will discuss possible changes and implementing agreed changes. In this, you make a protocol and then you discuss this with your doctors, colleagues, and the nursing staff. And the protocol you made is who the doctor who is conducting delivery make sure that the oxytocin is ready on the trolley, and at the delivery of the baby, the doctor makes sure that the staff nurse has given the oxytocin before clamping the cord, and also document this in her notes. Then you allow time for changes to embed before re-auditing. In this, you then, after implementing this protocol, you give some times to see if your protocol is working or not. Then collecting a second set of data. After the protocol is formed and implemented, then you again collect the data. For example, after 2 to 3 months, and you see and analyzing the re-audit data. Then you analyze your data whether postpartum hemorrhage cases have improved or not. Feeding back the re-audit results. Then after analyzing your data, you came to know that there is a significant decline in postpartum hemorrhages. So this is a good practice. So what will you So as this is a good practice, so you will make this protocol necessary for each doctor to follow, and you will broadcast your protocol in workshops on social media, so other hospitals or trusts or GP clinics will get benefit from this good practice protocol. Audit is not a static process, it is an ongoing process, because when you see a problem in your setup and you try to find the cause and implement change, and you have a good practice, you will again re-audit after some times, so as to make sure that the staff has stick to your protocol. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.